Which organism commonly causes community-acquired pneumonia in adults? Streptococcus pneumonia. In pneumonia, what lung sounds would you expect to hear in lung areas with consolidation? Bronchial breath sounds. What is the best way to identify the organism causing pneumonia? Sputum culture and sensitivity. What is the first treatment for any client with dyspnea? Oxygen. How is tuberculosis transmitted? Airborne in droplets. How long after a PPD test should the site be read? 48 to 72 hours. What is considered a positive PPD test? Redundant raised 10 millimeters or more. What are the signs and symptoms of tuberculosis? Chills, fever, night sweats, and hemoptysis. What are the serious side effects of TB medications? Nephrotoxicity and hepatotoxicity. What is the definitive test to diagnose tuberculosis? Sputum culture AFB. How long is the usual treatment for a client diagnosed with tuberculosis? 9 to 12 months. What is the most important nursing action for a client suspected of having tuberculosis to prevent further spread of infection? Respiratory isolation. What classic sign helps confirm diagnosis of asthma? Inspiratory and expiratory wheezing. What class of drugs is the first-line treatment for asthma? Bronchodilators. What is the most common and most serious side effects of bronchodilators? Tachycardia. What is the most important assessment for a client with Guillain-Barré syndrome? Respiratory assessment. What is the antidote for opiate overdose? Narcan. Which condition is described as pink puffer? Emphysema. Which condition is described as blue bloater? Chronic obstructive bronchitis. What respiratory disorder is most common 28 to 48 hours after surgery? Atelectasis. What is the most serious side effect of morphine? Respiratory depression. What is the best way to confirm a diagnosis of pneumothorax? Chest X-ray. What test would the doctor order right after central line catheter insertion in the subclavian vein? Chest X-ray to confirm placement. What are normal lung sounds called? Bronchovesicular. In a client with a chest tube to treat pneumothorax, what is an indicator of lung re-expansion you can assess from the closed drainage system? No fluctuation in the water-sealed chamber when suction is not applied. What is the accurate way to reassess lung re-expansion in a client with pneumothorax? Chest X-ray for comparison. What is the number one cause of lung cancer? Smoking. What is the definitive test to diagnose cancer? Biopsy and cytology exam. What is the key to increasing survival rates of cancer patients? Early detection. What is the first intervention when a chest tube is accidentally pulled out? Apply an occlusive dressing on the site. What is the primary goal of surgical resection for lung cancer? To remove tissues that have tumor in it while saving as much surrounding tissues as possible. What is the nursing focus for clients with terminal disease? Comfort measures, pain control. What is the definition of pulmonary embolism? Occlusion of pulmonary blood vessels. What are the classic signs and symptoms of pulmonary embolism? Shortness of breath, dyspnea, chest pain. In pulmonary embolism, what test provides information on the extent of occlusion and amount of lung tissues not receiving blood flow? Ventilation perfusion scan, VQ scan. What test is used for definitive diagnosis of pulmonary embolism? Pulmonary angiogram. What medicine will the doctor order as soon as a pulmonary embolism is diagnosed? Heparin. In clients with pulmonary embolism, what is the purpose of an umbrella filter placed in the vena cava? To break up clots into insignificant pieces. In a client with pulmonary embolism, what is the purpose of an embolectomy? Surgical removal of embolism in pulmonary vasculature. What is the function of pulse oximetry? It determines the percentage of hemoglobin carrying oxygen. In pleural effusion, what is the best way to remove fluid from the pleural space? Thoracentesis.